Bone repair and health. Surizade Garcia, Valerie, and Isabella. Fractures. If fractures a broken bone, it will heal whether or not a physician resets it in its anatomical position. If the bone is not reset correctly, the healing process will keep the bone in its deformed position. Close reduction. When a broken bone is manipulated and set into its natural position without surgery. Open reduction. Requires surgery to expose a fracture and reset the bone. Fractures can be minor or other quite severe and result in grave complications. Types of fractures. Fractures are classified by their complexity, location, and other features. A transverse occurs straight across the long axis of the bone. Oblique occurs at an angle that is not 90 degrees. A spiral bone segments are pulled apart as a result of twisting motion. Commuted several breaks results in many small pieces between two large segments. Impacted, one fragment is driven into the other, usually as a result of compression. Green stick, a partial fracture in which only one side of the bone is broken. An open fracture, at least one end of the broken bone tears through the skin, carries a high risk of infection. A closed fracture is when the skin remains intact.
Bone repair stages in fracture repair. 1. The formation of hematoma at the break, blood vessels in the broken bone, tear resulting in the formation of clotted blood at the site of break. The served blood vessels at the broken ends of the bone are sealed by the clotting process. The formation of fibrocartilaginous callus, fragments of the blood clot remain. Fibroblasts and osteoblasts enter the area and begin to form bone. 3. The formation of a bone callus. The fibrocartilaginous callus is converted into a bony callus of spongy bone. It takes about 2 months for the broken bone ends to firmly join together after the fracture. 4. Remodeling and adding of compact bone. Compact bone is added to create bone tissue that is similar to the original bone. Normal bone growth requires vitamin D, C, and A.
Bone health, exercise, and bone tissue. Exercise is really important when it comes to trying to bulk up, getting in shape, or even just um as a coping mechanism. What bone tissue has to do with this is that bone is a living tissue. So we are just exercising. Also, when you're just exercising, you're having your bone adapt to maintain your bone strength. And for nutrition, now making sure your exercise is quite the thing. But when it comes to maintaining what you've done, you have to make sure you have the right vitamins and that you are eating correctly. If you aren't caught up with a certain vitamin, it can lead to bone loss. And for certain vitamins like calcium and vitamin D, now you're thinking, what's calcium? Well, it's the most important mineral in your body and it helps maintain teeth and bones. Vitamin D helps your body absorb the calcium, and without any of these, your bones will become weak and really fragile. Other nu- Other nutrients like magnesium is also a vitamin that is almost a daily requirement. It requires bone density and helps prevent any stages of osteoporosis. And it's a bone disease that is caused, which is the body stops producing new bone creation.